Lavan here again. So we're just continuing our journey on arthritis, musculoskeletal problems. So today we're going to be talking about plantar fasciitis. For people that don't know, this is an area at the lower end of the foot, and we commonly get this when we have inactivity and have sudden movements, and we tend to find almost like a pricking sharp feeling just near our heel and at the source of it. I've got Rachel here today, who, as you know, is a physiotherapist, and we're just going to run through some of the symptoms and maybe things we can do to either avoid or in fact improve these symptoms for us.
Plantar fasciitis, super common, lots of people get it. And it can be quite debilitating. It's really quite painful. Sometimes you might be hobbling around because of it. But there are lots of things we can do to prevent it and also help it when you get it.
Right.
So like Lavan said, you might experience pain on the underside of your foot. This can come about through various ways, again, inactivity, or actually just things like wearing the incorrect footwear. I don't know whether, if you suffer from this and you're a woman that wears lots of high heels, I shouldn't assume, anyone that wears high heels, that can trigger it a lot, or actually sandals as well, with improper cushioning in the sole. Can actually be a trigger of plantar fasciitis.
Great. And I understand some of the patients, they kind of wake up and they notice that the first step they make, they notice that sharp pain, but as the course of the day goes, they tend to be alright unless they kind of overexert themselves. Is that right to assume?
Yeah, and that's just the tissues warming up. If you think about it, if you've been asleep all night, you haven't been using your feet, so the tissues are well rested. But as you slowly get some warmth and movement into them throughout the day, that's when the pain alleviates.
The fascia meets at about this point here, and it goes along as a fibrous tissue. So if we just draw a line, and at this point is the crucial bit where most people experience pain, and remember that's there normally in the mornings or after exertion doing sport. Exercises wise, I know some of our patients, they actually come to us and they tell us, Dr. Lavan, we've looked on the internet and we've heard about this tennis ball rolling, and we try to support and give advice because I assume we're trying to loosen or soften that area. Any kind of tricks or tips in terms of exercises that patients can do to help with this? As
mentioned before, change your footwear as a starter. You can do all the exercises in the world, but if you're still walking around in your heels or your sandals, you're just going to be undoing all your hard work. So a nice trainer or something with a supportive sole should work. You can do exercises to stretch the fascia in the foot. You can easily do this at home. Lots of self-management exercises to do, and we can talk you through them.
So guys, we've got Danielle here, one of our colleagues, and we've got Rachel, who are going to show us a few examinations on how to improve plantar fasciitis.
Okay, the first exercise you can do at home, you can do with anything. A towel, a tea towel, a bit of fabric. What I want you to do, Danielle, is can you put this around your foot and then just pull on the other two ends to your pain threshold, and what we're doing is we're stretching out the underside of that foot, which should hopefully help your plantar fasciitis. If you hold that for about 30 seconds and do 3 to 5 sets of that a day, hopefully that should start to help you.